So today I am going to be talking about language and the brain's role in language production, and specifically a type of language impairment known as aphasia. So aphasia is an acquired neurogenic language disorder, and it's going to be involving any or all of the following. So listening, speaking, reading, and writing. And so it's not going to be a result of sensation difficulties, motor function deficits, general intellectual deficits, confusion, or a psychiatric disorder. So those are all going to be exclusionary criteria, meaning that aphasia is always an acquired neurogenic language disorder. And so its cause is always neurological, which means that it's always a result of damage to some area of the brain. And so this damage can be caused by anything from a stroke to head trauma, surgery, tumor, infection. The two main causes are usually going to be strokes and head trauma. So that's what aphasia usually is a result of. And depending on what type of information you're looking for, and the type of lesion or malfunction that you're interested in, there's going to be several different types of brain imaging, techniques to look at kind of the anatomy or function of the brain, which will kind of help you then sort of decide where these lesions are, how the brain is functioning, and how that is going to affect language abilities. So, CT scans, MRIs, fMRIs, EEGs are all going to be useful when looking at someone's brain after a stroke and seeing if language is going to be affected. So there are several different regions of the brain that are involved in different, areas of language. And so here is a diagram of the brain. And then looking at this diagram, over here is the frontal lobe, up here is the parietal lobe, back here is the occipital lobe, and over here is the temporal lobe. So kind of one of the main areas of language is going to be located up here in the frontal lobe, known as Broca's area, and then and this is going to be responsible for language production. And another area in the temporal lobe over here is Wernicke's area, and Wernicke's area is responsible for language comprehension. There's a lot of other different parts of the brain that help us with our language production. So, for example, the primary motor cortex kind of helps with moving of articulators and creating speech. So, getting our language out. And then areas like the primary visual cortex here in the occipital lobe is kind of going to be used more when reading and writing and things like that. But as you can see, kind of all regions of the brain really are involved when it comes to language. So. Especially in the left hemisphere. Okay, so I'm going to be talking about a few different types of aphasia and kind of the brain lesions that lead to these kinds of aphasia. And aphasia is classified based on different types of similar behaviors and symptoms. And so it doesn't always mean that one person with Broca's aphasia is going to have exactly the same language abilities as another one with Broca's aphasia, but it's just sort of a good way to group the different types of aphasias based on kind of brain lesions and behaviors, symptoms, and it's a good starting point for developing treatment. All right, so the first kind of aphasia I'm going to talk about is Broca's aphasia. Broca's aphasia is going to be a result of, a stroke or head trauma, anything like that, that results in the anterior branch of the left coronary artery damage to that. And there's are going to be lesions in the brain in Broca's area, which again is up here in the frontal lobe, and also the inferior frontal gyrus. And so these lesions result in a lot of impairment in language production. So naming and repetition are going to be impaired. Speech is going to be really slow, not fluent. There's going to be a lot of pauses between words, and so it's just going to be very effortful. They do present with better comprehension abilities, and so they're able to comprehend kind of spoken words, written language, a lot more than they can produce it. And because of that, these patients can have a lot of self-monitoring, which means that when they say maybe a wrong word or what they didn't mean to say, they are aware of that, and they can then try to correct it or go from there. But they know for the most part that they are not saying what they would want to say. So self-monitoring is intact in these clients. And then the next type of aphasia is Wernicke's aphasia. Wernicke's aphasia is resulting from the damage to temporal arteries of the left coronary artery, left main coronary artery. And so lesions in Wernicke's aphasia are going to be in Wernicke's area and kind of just highlighted over here in the posterior superior temporal gyrus, which is highlighted right over here. And this can kind of also include the middle temporal gyrus as well as the inferior temporal gyrus. So it can kind of be any or all of this region of the brain. And this lesions in this area of the brain result in impairment in comprehension. So not being able to comprehend just simple words. It can, the severity can be from mild to very severe. Meanings of words are not understood. However, speech production is way more fluent than in Broca's aphasia. So in this case, speech is fluent. There are still going to be word retrieval difficulties because every type of aphasia has word retrieval difficulties as kind of a characteristic, but grammar and syntax is a little bit more complex for clients with Wernicke's aphasia. So because their Broca's area is going to be intact still. Then the next type of aphasia is global aphasia. Global aphasia is going to be resulting from damage to kind of all regions of the brain. So there's going to be damage in the frontal lobe, damage in the temporal lobe, and also damage in the parietal lobe. So, language production, language comprehension, reading, writing, even answering, simple questions, just word retrieval, all of that is going to be very impaired in global aphasia. So the next type of aphasia is conduction aphasia, and conduction aphasia is going to result from damage to the supramarginal gyrus, which is highlighted right here. It's going to be there. And also, this type of aphasia is going to be kind of fluent, but there is going to be an inability to repeat words. So repetition is really going to be what's affected the most in this type of aphasia. So the comprehension is, pretty much intact, and so they, like Broca's aphasia, can self-monitor and they are aware when they make errors. However, production is a little bit more impaired, especially repetition. So, we could maybe conclude from that, or that this region of the brain, the supramarginal gyrus, kind of is responsible, or one of the regions is responsible for repetition of words. So, because when it's damaged, then conduction aphasia occurs in That's when repetition is most effective. And then the next type is going to be transcortical aphasia. So there are two types of transcortical aphasia. The first is transcortical motor aphasia, and that's going to be there's not a specific location for this type of aphasia. There are kind of some subcortical lesions, and a little bit of prefrontal, kind of premotor areas that are affected. So kind of in this area. And then patients with this type of aphasia are going to have kind of similar symptoms to Broca's aphasia, in that production is going to be their main impairment. However, repetition is spared in transcortical motor aphasia. They are able to repeat words just fine, but still production and word retrieval are going to be difficult. And then the second type of transcortical aphasia is transcortical sensory aphasia. This type of aphasia is more similar to Wernicke's aphasia, but again, repetition is going to be spared in this type as well. So there is going to be some damage to the temporal kind of region of the brain. However, it's not going to be anything like Wernicke's aphasia, where the superior temporal gyrus or even the middle and the inferior are going to be damaged. There's just going to be a little bit of damage, kind of even closer to the parietal lobule, which is up here. Okay, and then I'm just going to talk a little bit about reading and writing impairments that kind of go along a little bit with different forms of aphasia and result also from strokes, or can result from strokes. So they're going to be grouped into dysgraphias and alexias. Dysgraphias refer to writing impairments, and alexias refer to reading impairments. So there's a bunch of different types of dysgraphia. So some of them include surface and phonological, and these are going to be people with these types of dysgraphia are going to present with kind of spelling, misspelling of words, difficulty even retrieving familiar words. And these are kind of resulting from lesions in the left perisylvian region of the brain, which is kind of, it's not pointed out in this diagram, but it's going to be a region that's right over here. And posterior temporal lesions, especially in surface dysgraphia, which is kind of difficulty retrieving familiar words. So posterior temporal region is going to be right over here. And lesions there usually kind of result in these types of dysgraphias. Deep dysgraphia, which is again kind of errors in meaning, and maybe if you're trying to write apple, you write pear, and errors in spelling, things like that. So that's all kind of left hemisphere damage, especially in sort of this area. The perisylvian regions are going to be one of the big ones for dysgraphia, so for writing impairments. There are other writing impairments that kind of are affected more from working memory, and so again in the left hemisphere, sort of the frontal and the parietal regions of the brain are affected there because they're sort of involved in working memory and even spatial attention, and so if you have a writing impairment in which you kind of replace one letter for another, or write a letter not how you are supposed to, things like that, though that's usually kind of a result of spatial attention deficits and working memory deficits. So, and then finally, alexias, which are kind of reading impairments, and so something like a deep alexia, which is a reading impairment that involves sort of meaning issues, difficulty sounding out words, especially words that you aren't familiar with, or words that are spelled irregularly, maybe reading knife as knife, or walk as walk, things like that, or if you've never seen a word before, not being able to sound it out. Just dyslexia, reading impairments, things like that, also result in usually from left hemisphere lesions. So kind of gives us a little bit of insight into the left hemisphere of the brain and how important it is in not only language production, not only in speaking and understanding, but really in reading and writing as well. So I hope that this video provided some helpful information on aphasia. It's something that I'm very interested in, so I hope that I sparked your interest too. Thank you. Oh.